Part 2 of me explaining the pathophysiology of many conditions you will learn about in nursing school. Today is endocarditis, and this one is exciting, okay? Okay, there are two things that we need to get down and master. Endothelium is the inner lining of blood vessels. When we're talking about the heart itself, that lining is called endocardium. It's the same type of cells, just different name depending on if they're lining a blood vessel or lining the inside of the heart. Both the endothelium and endocardium are smooth and normally resistant to bacteria. The endothelium keeps blood moving through vessels, and the endocardium protects the heart from infection. Trouble starts when either of those are damaged. Now that we've mastered that, we go into the patho. Organisms, either bacteria or fungi, enter the bloodstream through some sort of source. That could be IV drug users, invasive devices, dental procedures, etc. We call this bacteremia, bacteria in the bloodstream. They travel through normal circulation until they reach a vulnerable site. I'm going to call this a sticky site. These sticky sites form on damaged endocardium, and the damage can happen for several reasons: turbulent blood flow, prosthetic valves, congenital heart defects, or other structural abnormalities. Okay, I need you to stay with me here. At these sites, platelets and fibrins start to clump together, forming small sterile deposits called non-bacterial thrombotic vegetations. We're really getting deep into it right now, okay? Okay, now later, when bacteria arrive into the blood, they can stick to these clumps and turn them into infected vegetations. I'm gonna explain this in a second, but that is our hallmark sign of infective endocarditis. Now this is where it gets fun. Bacteria or fungi stick to this sticky site. Platelets and fibrin pile around them, building a tiny little castle wall that actually protects their intruders. Like, why would you do that? Anyway, inside this castle, bacteria or fungi are sheltered from immune defenses, which means our own immune cells can't reach them, and antibiotics have a hard time getting into them. This is another classic issue of endocarditis. And as these vegetations, these intruder castles grow, they can start to damage the heart valves, making them leaky or dysfunctional. And then bits of these vegetations can go on a destructive road trip throughout the body. And that, my friends, is where the symptoms manifest. And boom, there you go, infective endocarditis.